Sales and Marketing South Asia AliveCor bu taramna uksari aduga loinana all invitees singbu su taramna uksari loinana print and electronic media marumapang punamapu taramna uksari program se makha chatharakpa oina akoina felicitation program ama tawjanaba akoigi chief guest oina lengbira iba Dr. Sapam Ranjan Singh, Hon'ble Minister Health and Family Welfare and IPR bu felicitate tawnaba Shri Munish Yadav, Director Sales Marketing South Asia AliveCor bu kausanjari. Mathang chatharpo oina felicitation program ji mathang chatharpo oina Shri Somorjit guest of honor in nation biriba Shri Somorjit Ningombam Director State Health Mission Government Manipur tawnaba Shri Moirangthem Dijendro bu kausanjari. Program asi makha chatharakpo oina Shri Munish Yadav, Director Sales and Marketing South Asia AliveCor bu AliveCor gi matang da introduce amasung presentation pinaba kausanjari. Please welcome Sir Munish Yadav.
Thank you very much. Thank you very much. Very good evening. First of all, I introduce myself. I am Munish Yadav. I am Director Sales India Business for AliveCor. And I really appreciate you spare some time to come for a discussion. So I thankful to our chief guest, Dr. Ranjan, Honorable Health Minister, and Dr. Sapam. So before deeply dive into the discussion, I am really thankful to you to give me an opportunity to launch AliveCor in Manipur. So on कर दें on है Thank you very much. So this is a small clip where we try to showcase ourselves, what we are. So now it is very important for you to understand what exactly we are and who we are. So AliveCor, we started our journey in 2011. From 2011 to till date, we are available in 42 countries. AliveCor is a technology-based medical device company. AliveCor is the world first US FDA-Cleared medical device having a ECG monitoring solution. AliveCor is the world first US FDA-Cleared medical device which can record ECG lead medical grade ECG in just 30 seconds. AliveCor is the only medical device company in the world which can diagnose atrial fibrillation in 30 seconds. AliveCor is the only company into the world who can diagnose arrhythmia in 30 seconds. AliveCor is the only medical device company in the world which can provide a detailed view of heart in just 30 seconds. AliveCor is the only medical company in the world which can provide a personalized ECG monitoring services. So the most important thing is we are the only company into the world who having such kind of a technology, and our main objective to reduce the mortality rate in entire world. And even though we can percolate the same discussion in India. So we are the AliveCor. In 2018, AliveCor is the world's most innovative company, and we ranked ourselves as the #1 in artificial intelligence as well as in the machine learning. As I discussed, we are available in all that in 42 countries, including entire Europe, entire UK, US, Canada, Malaysia, and entire Asia also, even though in Asia when I'm talking about, so we are available in Pakistan, we are available in India, we are available in Mauritius, now we are available in Manipur. So the most important concern is this, where we can be position ourselves. So I can use the layman words so that everyone can understand. So why ECG is important and where we can be position ourselves. So when I'm talking about positioning of our AliveCor, our device, so we position ourselves as a remote monitoring system. Remote monitoring system itself, it means I am sitting in Mumbai, I am sitting in Manipur, and the patient is in Mumbai. So as he touches the device, entire data come down to Manipur within a fraction of seconds. And we are into the position to understand what is the heart health condition of the patient. So this is called as a remote monitoring system. Second, it is a pure replacement of Holter. So when I'm talking about the Holter is a very costly affair. If any doctor want to know the heart health and heart condition of the patient, right now he is only having a few options available. One is a Holter, second is a conventional ECG machine, or third, जैसे आप हो वैसे रहिए. So हमारे पास we have only 3 options. So but the issue is this, Holter is a very, very costly affair. It cannot come into the pocket of every patient. If doctor want to understand the heart health of the patient, he has to put the patient on Holter. Now we have an alternative option available in Manipur, and it is an economical which is come into the pocket of every patient, and it's a pure replacement of Holter. Third is an event capturing device. We can position ourselves as an event capturing device. Event capturing device itself, it means most of the time when you approach to the doctor, you have a palpitation, you have a problem. When you approach to the doctor, doctor बोलता है कि आपको कोई problem नहीं है, सब कुछ ठीक है, everything is fine, no need to worry. But जब आप घर जाते हैं, आपको internally मालूम है कि you have a problem. So जब आप घर जाते हैं, घर जाने के बाद आप देखते हैं you have a palpitation. So with this device, if you capture the particular event, it is very, very useful for the doctor to put you on a right medication. Because right now the situation is this, the doctor putting you on a without ECG, doctor put you on a medication on the basis of assumption. So this event capturing can help you out to put a patient on a right medication. Third, we can consider ourselves and we project ourselves as a life-saving device also, because as you touch the device, let's say an example, you are in Manipur, as you touch the device, data will be immediately come to, let's say an example of your rims. The doctor is into the position to tell you 3 interpretation immediately. One is all okay, second is rush to OPD, and third is a rush to emergency. It means all okay means you have a palpitation. When you touch the device, data will come down to rims, and the rims in a position to tell you कि no need to worry, आप घबराइए मत, आपको palpitation है but आपका heart health एकदम ठीक है, you are okay. Second interpretation which comes is rush to OPD. Itself it means there are certain variation in your ECG, And on this variation, the doctor can put you on a medication, and whenever you have time, visit to the doctor so that the doctor can put you on a medication called as a rush to OPD. And third is a rush to emergency. Rush to emergency itself, it means as the patient is, let's say an example, patient is in Manipur, as he touched the device, data will come down to RIMS, and RIMS, with that tag time of 1 minute, the RIMS called patient is having an emergency condition. It means the patient ka golden period on ho gaya hai, he is having a 30 minute. So this device, we can use this device to save the life of the patient, and just because of this device, we are projecting ourselves to reduce the mortality rate into India. Now the question comes in our mind, hum sabke dimag mein aata hai, why ECG is important? Why ECG? So, but ECG is very, very important. Why so? Because ECG can help you to identify or to determine or detect arrhythmia. Arrhythmia is a rhythm. Rhythm हमारे दिल का एक rhythm होता है, उसको detect करने के लिए ECG is very, very important. Now the ECG is very, very important for coronary heart disease. ECG is very important to detect heart attack. ECG is very, very important to detect cardiomyopathy. So this is a very, very important. If you do your ECG on a regular basis, तो आपको probably हम cardiovascular disease से दूर हो सकते हैं. So now the question comes in mind, what is the why in India? But why in India itself, it means heart health. If you talk about the heart health of India, the CVD strike in India decades earlier than the Western country. हम लोग पहले हैं, Western country से पहले heart का problem India में आ गया है. Up to 13.2 coronary heart disease prevalence in urban India. And India CVD death rate is 272 per lakh population, is higher than the global average population is 235. So India is very, very high. So in terms of atrial fibrillation is an undiagnosed disease. If you talk about atrial fibrillation, the prevalence is, official prevalence of atrial fibrillation is 1.6 in India. Unofficial it is more than 5%. So as I'm talking about the corporate overview of my company, so we started our journey in 2011. From 2011 till 2023, we are very much committed towards the health system. So we first in 2011, we launched a ECG machine, phone case ECG machine. So ये phone के पीछे लगता था, आपको दिल के ऊपर रखते ही आपका ECG हो जाता था. In 2011 we launched. In 2015-14 we launched single lead ECG machine in US. In 2015 we launched a interface between the patient and the doctor, so that all the data will go to the doctor, and the doctor is into the position to immediately detect and put a patient on a right medication. In 2017 we launched a cardiac band. In 2019 we launched a cardiac station. And 2019 we are the only company into the world who can launch US FDA 6-lead ECG machine into world, and we are available commercially from 2020 in India. Now we are available in Manipur. So in terms of increasing adoption level, I am very much confident to inform you that 90% cardiologists of the world, 90% cardiologists of the world, they know us. They are using our device. They are putting a patient on our device. So every first person, every single doctor is using, US is using our device. There is a 1.8 million lifetime users with our device. There is more than 150 million ECG we are recording till date, and we are approved by 160 pre-reviewed articles with us. So as I discussed with you, we are launching a Cardia Mobile in Manipur. Cardia Mobile is 6-lead, world's first US FDA 6-lead professional ECG device. Cardia Mobile is very easy to use. It is only a 24-gram ECG machine. अभी तक आपने जितनी भी machines देखी होगी ECG machine, that to be into the 1 kg or 2 kg का है, there are a lot of wires over there. But this machine don't require any wire, they don't require any jelly, they don't require any paper. So this is only a 24-gram ECG machine. So let me show you how this machine is to be used and how this machine is beneficial for your day-to-day routine.
Dealing with COVID-19, our fight with other health challenges like heart disease has taken a back seat. So I've gotten an expert personal heart health solution to monitor mine and my family's heart health 24/7. Cardia Mobile 6L and see what it does. On the main screen of the Cardio app, and I tap, record your EKG, like so. And then you lightly put both the thumbs on the top electrodes and touch the bottom electrode to the bare skin of your left knee or your ankle. And you hold steady for 30 seconds to get a medical grade ECG without any gels or any wires, and with accurate results that can be delivered to my smartphone in just 30 seconds, which I can then send to my doctor for consultation without having to risk going out of my house at all. Do you see how convenient this is? I've actually taken my ECG while talking to you. So this World Heart Day, don't take it easy. Take ECG with Cardia Mobile 6L, which you can buy now at AliveCor.in.
Thank you very much. Now the Cardia Mobile is now available in Manipur. So when I'm talking about the Cardia Mobile, it is a very easy and handy to use. You can use this device at your home. It can give you a better understanding about your heart health, and it can help the doctor to identify your heart health condition and put you on a medication. So why the doctors are using this device? Doctors are using this device, and why the doctors are supporting two Cardia 6L machine? It is just because it is easy for the patient to use at their home. It is very, very easy and a useful device to early detection. It is a very convenient to understand the short-term and long-term self-monitoring, and immediate feedback goes to the doctor. So this is only a 4 reason all the doctor all over the world, the people are using this device. So these are the 58 interpretation and the determination. ये 58 conditions हैं जो डॉक्टर के लिए काफ़ी हेल्पफुल है. जो डॉक्टर हमारी मशीन को, जैसे ही मशीन को आप टच करते हैं, सारा डेटा डॉक्टर के पास जाता है. डॉक्टर इन 58 कंडीशन में से इमीडिएटली इसको सिर्फ टिक करता है कि पेशेंट को ये प्रॉब्लम है, और उसका इमीडिएटली प्रिस्क्रिप्शन रिलीज हो जाता है. वी हैव अ सॉफ्टवेयर अंडरस्टैंडिंग, वी आर अ टेक्नोलॉजी बेस्ड कंपनी, so we can immediately detect. We are into a position to support the doctor. So these are the 58 interpretations where we can help the doctor to immediately identify the heart condition of the patient. How AliveCor is beneficial for the Manipur? That is very, very important slide, sir, and important for us to understand. It's very, very crucial also, because we collect this data. The source of the data is ICMR. This slide is talking about the disease burden in Manipur. As we know, we are the diabetic capital. Same context, the disease burden in Manipur is very, very high. If you talk about the age graph from 0 to 14, there is 1 point prevalence, the disease burden is 1.9%. When I'm talking to 15 to 39 age, at the age of 15 to 39, the disease burden is 9.6%. When you go up to 40 to 69, the disease burden is 28%. 28% means अगर आप 100 लोगों को देख रहे हैं तो 28 लोगों को इस तरह की प्रॉब्लम दिख रही है. In a same context, when you move from 70 and 70 plus age, the chances is very, very high. The disease burden is very high, sir. It is 29%. So disease burden of cardiovascular disease is very, very high in Manipur. That is the only reason we thought to come into the Manipur and support to the citizens of Manipur. And this is the current cardiac health system in the Manipur. So when I am talking about the cardiac health system in the Manipur, there are certain few issues which is important for me to address. It is the average availability of cardiac health service and limited reach for people in rural areas. 1 to 2 hours is the average time taken for an ECG during an emergency condition. Lack of heart health awareness lead to a number of casualties among the general population, and financial burden, definitely yes, and there is a poor inconvenience. So higher purchase and maintenance cost of the cardiac equipment in Manipur, and the high prevalence of cardiac disease, and the large portion of undiagnosed population in Manipur. So this is a major current cardiac health system in Manipur, which I personally feel that I put it into a paper. So what exactly our main objective is this? So we are a technology-based company. Again, I'm just focusing on this thing. So our main objective is to convert the conventional discussion into a digital form. So that is the only reason AliveCor is coming into the picture. We transforming the digital health in the Manipur. We're trying to transforming the digital health into a Manipur. So this is the entire system which we look forward for with the support of Sir and support of citizens of Manipur. So our main objective is very, very clear. AliveCor support Manipur into 2-3 reasons. First, if you detect early, if you diagnose early, there is a very easy understanding to treat early, and we can immediately put a patient on a right medication. So when I'm talking about the positioning case, there are a few case studies which I'm trying to show you in terms of, there is a hospital called as Medanta in Delhi. So Medanta is using this device as an ECG at home, and they are using this device to save the life of the patient, because as any patient of Delhi or any patient of Medanta, they trust the device, all the data go to the command center of Medanta, and the Medanta is into the position to interpret it into 3 forms. One is all okay, second is rush to OPD, and third is a rush to emergency. So this is a few case studies which I am trying to, I'm just showcasing the things. This is a case of if the patient is using the data, it come into a different formats. It's come into the format of, like, this is a green means the patient is in healthy condition, orange is there are certain variation into the ECG. If it is a red, it means patient is having a problem of atrial fibrillation or the patient is in a critical understanding. So these are few case studies. Thank you very much. So thank you, sir. Thank you, Honorable Health Minister. Thank you very much, Dr. Somorjit, Director State and Health Mission Manipur. Thank you very much, sir.
Thank you, sir, for a nice presentation about the AliveCor and your concern about the Manipur. So, going further for this program, I would like to call upon our chief guest, Dr. Sapam Ranjan Singh, Honorable Minister Health and Family Welfare and IPR, Government Manipur, to the dais. Secondly, I would like to welcome guest of honor, Dr. Somorjit Ningombam, Director Sales, State Health Mission Manipur, to the dais. And lastly, but not the least, I would like to call upon Shri Munish Yadav, Director Sales Marketing South Asia, AliveCor. Thank you, everybody, and we now go upon next program is launching of the product AliveCor ECG device by chief guest and guest of honor. Come here. Mayam program masibu makha satha berko oina. I would like to call upon guest of honor, Dr. Somorjit Ningombam, Director State Health Mission Manipur, to have a few words.
Good afternoon, everyone. Respected chief guest of today's function, Dr. Sapam Ranjan Singh, Honorable Minister Health and Family Welfare and IPR, Shri Munish Yadav, Director Sales and Marketing, South Asia of AliveCor, all the invitees, guests, ladies and gentlemen, I'm very happy to know that we are getting a world-class product here in Manipur through AliveCor. And as we all know, that the disease parameter, the epidemiology of the world as well as in Manipur, as well as in India, it has been shifting from the infectious diseases to the chronic diseases. So now we are able to control almost all the infectious diseases which were prevalent 10, 20 years back. So we have been able to control our malaria, leprosy, TB. We are almost on the verge of elimination. Now we are faced with the epidemics of the NCDs, that is the non-communicable diseases. Earlier, at the time of independence, we were burdened with infectious diseases like diarrhea, then measles and the viral diseases, which we were able to prevent with the help of vaccines. So now is the age of non-communicable diseases like heart diseases, lung diseases, cancers, and road traffic accidents. So the disease paradigm is shifting now. So in this age, we just saw the demonstration of AliveCor, this ECG machine, which seems to be very handy and very easy to use. So it is not only, I don't know whether you need a doctor's prescription for this device. Do we need a doctor's prescription?
Yes, sir.
No, I think like now everybody is using the glucometers and the digital BP machines. Everybody is buying and keeping at home. So like that, this device also can be used for those who are diagnosed with the disease, and for those who are not diagnosed, you can use it as a preventive machine, though it cannot be, as we all know, the machines may be very good, but the interpretation is where it matters. So now that I think this device will be connected to a panel of doctors where the reading will go directly to them, and then they will do the diagnosis for you. So this type of devices, as we all know, the artificial intelligence is now part of our life. In every walk of life, we are using artificial intelligence, and this is one of them. In my opinion, I think it will be a good device to be kept at home or in the clinics or in our sub-centers, PACs, where there is no, where the specialist doctors are not available for diagnosis. So as we all know that prevention is better than cure, so if there is any abnormality in our heartbeat or in your pulse where it is detected by our peripheral workers like the ASAs, ANMs, and the nurse CHOs, I think it should be a good device to be kept in our health facilities. We're looking forward to it. We'll definitely, after learning more about this device, and as you have claimed that it is FDA-Cleared, it should be no problem. I think it should be a useful machine for our fight to take as our Honorable Chief Minister is, as you all know, that he is very much aware that we must take to the last man in the village. Instead of they coming to our hospitals, we should go to their homes and then get the treatment available to them, diagnosis or treatment, whatever. So thank you very much, AliveCor, and we look forward to see what it can do to help us, our state and our people in prevention of NCDs. Thank you so much.
Thank you, sir, for your valuable words. Now, I would like to call upon our chief guest, Dr. Sapam Ranjan Singh, Honorable Minister, Health and Family Welfare and IPR Government Manipur, to have a few words.
mayam pumnamakpo koramjari ngasi AliveCor gi ECG gi portable ECG machine amagi launched tawbagi thoram sida dai selection biriba the State Mission Director of NHM, Dr. Somorjit Ningombam, aduga sigi mission zigi the sales and marketing of South Asia gi Director Biriba AliveCor gi mingwina Panjarabada Shri Munish Yadav asigi launching functions in Biriba Kwai Putmamak. I had an alumna Kuramjari. Hojikta, as was mentioned just now, disease burdens the Hanalairam Badugi, it has changed towards a different direction. Hojik disease burden, it's more towards NCD, the non-communicable diseases. Duga NCDs ki marak diseases or cardiovascular diseases ki zi yamna achauba percentage ama disease burden hojik pithribi gi oina oire sigi sida akoi ki country akoi ki India zo disease burden as far as the cardiovascular disease is concerned, it's very, very high. Manipur ki zo ngasai yeng bigi budo cardiovascular diseases ki enozida almost 40%, 45%. Could be higher. Many of the cardiovascular diseases, mayamna khangdana yum the hospital yaruktana legidaba treatment se karino khangdangi kaim tawde khalamaga legidaba kudak da many other. This is everywhere. And asigi burdens is hongak kanjeda. The importance of non-communicable disease ki Sigi the government ki side ki am achauba focus sama yam achauba focus sama hojik piri Union Ministry de zo duga khoi gi Manipur gi health wibak khoi gi Honorable Chief Minister gi advice matungina mahaki yamna committed oiba effort amaki makhada we are going very, very serious for management of the non-communicable diseases. As all of us know, akoy Manipur da karigidamakta Chief Minister's Health for All yung bigibdo. As I rightly said, healthcare delivery at the doorstep for non-communicable diseases. Non-communicable diseases we are increasing the number of cases, the number of diseases that we would be taking up at the doorstep through the CMHA. CMHA, Honorable Chief Minister, ki wakalon, mahakna khanzagiba wakan, mahake vision, si tawraga si kanagani habagi wakalondo. It's coming into reality. Masa diabetic oi haisi sukang khangdaba. Cardiovascular disease like haisi khangdaba. Cardiovascular disease, the BP is Europe. Khangdaba. Cancer, breast cancer is the khangdaba. Atop palaina. Yamna kidney diseases, yamna akoigi handaki chai ama. CMHA horopagis the praza grassroots levels, the yamna achauba percentage ama khangba haure. Praza gidamakta labor government, praza gidamakta grassroots. Yam toina haibane Honorable Chief Minister naso. Akoigi lamdam da laiminari ba khoi myamse nadribo doctor da check up ki wakhalon. Ki wakhanse amata laite. Until unless we are sick, until unless we are bedridden, until unless we are able to eat, doctor da check up the way wakhalon sukan khande. And it is a fact. Aduna akoigi as health care is the NCD kaktan tabi the atopasida. Henkalakpagi matung inna. We should also use the facility of the artificial intelligence ki technology.
adugi season abam jo mathau ta adugi de maktani hojik even this akoi AliveCor gi si puthoi ba si jo it's through the artificial intelligence sigi we should make good use of it sigi season aba kanje da hojiki sida demonstrate to bigi badu di yamna easy to use quite maru in easy to use obdo manam the everyone hojikti technology gi matam nina akoi gi the world has become so much digital in its nature and loina smartphone amamloin pair banina sigi smartphone toraga I'm sure through WhatsApp I think you can send a message through WhatsApp right I don't know even WhatsApp toraga to your own doctor or to a concerned doctor or your physician sigi thaba kanda I'm sure they can interpret the result or an interpretation of some of the measure, whether it's a fibrillation or any other. I'm sure they should help a lot in taking care of oneself, and especially for people who are already aware that yes, I heart problem lay have the more towards even for screening modality also it will be useful, and also for people who know that they are having a heart problem. I'm sure through this it would help a lot in having a review of the ECG off and on at a regular interval. And the Sigi cannot see, but Asaidigi cannot only he has spoken so much about the machine, about the importance of this machine, but he hasn't revealed the price. I think that could be a business strategy. Maybe you keep your business strategy, we'll focus on the health of our people. The business strategy is different, but our concern is for the welfare of our people. That is the government's #1 agenda. So, Sigi can see the technology. The world is changing. The world is changing for the better. The world is changing for the towards development. Everywhere there's development in terms of the internet, in terms of the technology. But at the same time, with so much development in a digital platform, there's also a negative side towards it, because recently I was invited for the mental health program. Over there, the discussion was on the pandemic, a looming pandemic that's coming up all across the world, and that is the digital pandemic. And here, while I speak, I would say that at least 10 of you all here, at least 10 people here, maybe in a crowd of 100, 10 of us are busy with our phones. So that is the addiction that all of us have on this digital pandemic. I think it is everywhere. Even phone the first thing so everyone here, at least I would say 99% of us here head phone never message again what we do, we phone and especially for us who are in the who are public, related thing. Our phone is always with us, and plus with our head of the state always wanting us at our toes and making sure that everything is in order. We have to be always vigilant to receive his calls and make sure that things get done for the people at the right moment. I think this is one of the concerns of the Honorable Chief Minister. Every day he advises us, he gives us ideas, he gives us, his vision of making things good for the people. And it's a handheld machine. It's a handheld. Advertise the way one today. But slicky pocket yes, it's FDA high, but it's a new technology, which is, at least for our state, it's a new technology for our state. We may have to, the experts would be the ones who are practicing in the field of medicine, especially the physicians and the cardiologists who would know more about the effectiveness and the quality and the sensitivity and the specificity of this particular device. I'm sure we should, it's all about letting the people know what it is. Prasada Kandragadi, Akoi the Kandragadi, Mayam the Kandragadi, Prasa, Potsikarino Kandragadi, Akoi, Head Yang Bakan, it looks more like a mobile phone. mobile phone jaga link tawdoini khotoini du heart ki just the sikana ni habagi keno do manam di housik si ta saying everywhere aya matam da akoi India ki at the highest level health ki issues discussed over kan the NCDs it's one of the top priority see the adom keno da discuss taw later bani because yamna maru oiba yamna nga sa haje ki bido disease burdens disease burden akoi mortality je hojikti 65 to 70% NCDs na cost away and it's a fact it's on record aduna sugumba machine yamna nungai je ai di ngarang khaktani aigi marup dijona sugumba ama potsi keno tawni launch tawbudu da kano the yomina say haibadu da ilakchabani more so about the uses, the effectiveness, and as haibadu sigi keno me am the experts will know better. Let's let the physicians and the cardiologists get used to it. It's through them that the faith and the response by the people would come about. I'm sure this becomes a game changer for the people who are having heart problems, and as a screening modality for all the people of Manipur. Yes, we are going at the grassroots level in case we suspect anyone of having any of the NCDs. We do have a tier 2 where they are taken care of. And the most important thing is healthcare delivery across the length and breadth of our state. Duga akoigi prajasing is the quality healthcare piba at the quaidagi pesha yari makai prajada sanghandaba. Akoigi wakalon akoigi mantra di alkaduni. Prajada yaringai out of pocket expenses yaringai handaba. Aduna ni akoi government ki site tagi hojik out of pocket expenses yaringai handana bahadana through the CMHC Honorable Chief Minister ki wakalon gi matam da Putopi ki Chief Minister ki hakchel ki tengbang duga PMJY ga hina kano tawri ba miyam se prajada ki yaringai the government akoi level kya da akoi ki free diagnostics chathariba handak the 53 tests or ambadu handa akoi jaga khara the 134 smile test henkale ana smile tawduna jaga khudigi akoi ki center khuding mak ayam but mainly district hospital ki levels the khara wang free diagnostics to piraga atai jaga khazna khajikajum kano across all the length and breadth of our state sikis henkatna bedam ta koi yam kanna meeting jangjari akoi ki state mission director Zoyauri. And it is a joint effort. It's a joint effort. Healthcare deliveries. It is just not part area. The healthcare facility has to be improved in all ways. Always. And ultimately, as I've said, the very much I would say the one thing which our Honorable CM is concerned, it's the healthcare at the primary level. Healthcare at the primary level, adudagi referral system na program hierarchical way da skeno tawga yari makai akoi prajagi yari makai nada na ba aduna ni CMH horiba na ba taraga as far as practicable eligible beneficiaries ingi the CMHT PMJY season ba hospital da pukalaga so yari makai akoi prajada phajana paisa yari ngai changhanda ba health kenojida. So that's the Honorable Chemgi, it's his feelings from the core of his heart, and this is one thing which he always advises us to make sure that healthcare at the primary level, it's at its best. And NCD amukahanna haijabakanda NCD yamna every mui kuding mak akoi concerned of mathau tare akoi loina khangmina ba mathau tare NCD kaino and what akoi sigi je tawraga si phagani haibado akoi khangmina ba mathau tai ngasai da so akoi we were having a seminar on the breast cancer, which is yamna common oirakpa yamna suddenly common oirakpa haiba tare hana de ju lerami, but suddenly there has been a spurt duga akoi gi CS cervix ka na lebda audagi breast cancer jina hena wangkhalakpa. And it was a lot of concern for us. And cannot do nang side so aduki to work to awareness, prasada awareness yahun bi bhai batare. ꯑꯩꯈꯣꯏꯒꯤ ꯕ꯭ꯔꯦꯁ ꯀꯦꯟꯁꯔ ꯍꯥꯏꯁꯤ ꯀꯔꯤꯅꯣ ꯀꯔꯝꯕ ꯀꯥꯟꯗ ꯀꯃꯥꯏꯅ ꯑꯩꯈꯣꯏ ꯁꯁꯄꯦꯛ ꯇꯧꯕ ꯌꯥꯏ ꯁꯤꯒꯤ ꯑꯩꯈꯣꯏ ꯆꯦꯛꯁꯤꯟ ꯊꯧꯔꯥꯡ ꯂꯧꯍꯧꯕ ꯐꯩ ꯍꯥꯏꯕ ꯈꯣꯠꯄꯒꯤ ꯀꯩꯅꯣꯗꯣ early treatment early diagnosis ꯀꯩ ꯀꯩꯅꯣ ꯇꯧꯕ ꯃꯌꯥꯝꯗꯣ ꯑꯗꯨꯒꯤꯗꯃꯛꯇꯁꯨ ꯑꯩꯈꯣꯏ ꯉꯁꯤ they are still having the keno duga ai ngasi je siung lak akhat chat leire and today for our state taseng har ke yamna it's a historic day for us karigino haiba kanji the honorable union home minister na nan tang taruk ta akoi gi nongpok thong kangla gi nongpok thong sangha gi bedu ngasi honorable chief minister na lead tawbiraga kangla thong nongpok thong du hangaga mayam da praja da sinagre which is considered a very sacred bridge and which was there before Honorable Chief Minister ngasi ayuk sangha gi baduga loina na I hope all good things happen to our state aphaba khuding ngakta duga khoi leina leitaba duga khoi kwai pum namak achang phana leiba akoi kwai pum nong chawkhat minaba shanti raksha purakpa development ki mai gai da hana chali basdi hena amuk hanna channa bi da makta akoi kwai pum namak isa isa thazaba ishor da khairamina si haijara kai swade sum tension ki kwai pum namak nulu na khairam jari thank you jai hind
Matangi program chat oina koi board of thanks pipine ta miss likibo ong ta kausan jari
Hon'ble magtada ngasigi AliveCor ECG device launching ceremony asibu saruk yaba lakbiriba khudingmakpo ikai khumnabu chabaga loinana nolokna khurumjari ngasigi thauram asigi aikoina hajaruba matamda harau harau yabiraktuna ngasi aikoigi mangda chief guest ki famfam langda nganthoi biriba mingoina panjarabada Dr. Sapam Ranjan Honorable Minister Health and Family Welfare and IPR Ikai khumna jaraba Honorable Minister na ngasigi chillaba matam kaya kaithok piduna lebak miyam gi support to bibo oina asigum laba device asigi launching ceremony da sarukiya biba amadi support bibiba ojabu thagat pafangdok chari anisubada ngasigi gas of honor gi famfam langda ngan thoi biriba mingoina panjarabada Dr. Somorjit Ningombam Director State Health Mission Manipur ngasigi chillaba matam kaya kaithok piduna thauram asibu mapung fahan biba sarukiya biba hainingai litena thagat pafangduk chari ahum subada thirdly I would like to give my humble gratitude and thanks towards Mr. Shri Munish Yadav, Director Sales and Marketing South Asia AliveCor for your detailed production analysis and introduction. I hope this ECG device will surely benefit the people of Manipur, which is cost-effective and which is of high advanced technology. Thank you, sir, for your presence. Marisubada, ngasi Manipur ki kachin koya sinbatungna asigumba chawkhatlaba advanced technology ama leire haina lebak miyamda kachin koya sinbatungna inform tawbigadoriba print amadi electronic media gi lengbirakliba itilinau singbu thagat pafungdukchari marishubada iroi loipoina tauramasibu mapung fahan binaba phan bigani habigi asada loinana launching ceremony asibu thawai hakchang yauna saruk yaba lakpiriba tinbiriba lai guru ahalaman itilinau khwaipum namakpusu amukhana thagat pafungdukchari. Thank you.